My name is Dr. Frank Zadar. I'm an interventional cardiologist with Austin Heart. I work at the Heart Valve Clinic at the Heart Hospital of Austin. We started our program approximately 5 years ago, and we're the first in Central Texas to implant transcatheter aortic valves. People have often described it like a heart catheterization. We use local anesthetic, we use moderate sedation, we talk to the patients through the procedure, make sure they're relaxed and comfortable, and during that we're able to replace the valve without a heart-lung machine, without general anesthesia. It's a dramatically different experience for the patient and profoundly less invasive. So as this valve progressively narrows, the heart muscle is trying to squeeze, and that valve just can't open and close the way it's supposed to. It's like a governor on an engine. They just can't get past a certain point. Most patients who come to the valve clinic with aortic stenosis are seen by the multidisciplinary team, and a strategy is made to replace the aortic valve. When we do that, it involves typically a transcatheter aortic valve replacement, where usually we go through the groin and implant a new valve inside their old scarred down valve. Once that new valve is functional and the heart can contract and eject blood the way it's supposed to, patients instantly have an improved output and sustained over the 1 month until we get to have them back in our clinic to regroup and make sure they're healing up from the small access site in the groin.
I'm Johanna Carr. I'm an interventional cardiologist with Austin Heart and work at the valve team at the Heart Hospital of Austin Valve Clinic. The exciting thing about this area with transcatheter valve technology is that things are always happening and moving and getting better for our patients. We can treat any person who is at high or intermediate risk for complications of open heart surgery. That could be that their lung function is not perfect. It could be that their age is very advanced. It could be that they have some frailty, which we have very objective ways of measuring. We of course sit down with our entire valve team, the heart surgeons, Dr. Zadar and myself from cardiology, and we weigh the different options. We also see a lot of folks who have a leaky mitral valve, and the fancy term for that is mitral regurgitation. There's different reasons why a person might have a leaky mitral valve. Some of those folks are not optimal candidates for open heart surgery, and we're able to put a clip that is attached to the mitral valve, and it reduces significantly the leakage. It's another one of these transcatheter operations that we can do with just a poke in the groin and without having to put the heart-lung machine. So it's another option for older folks who may have debilitating valvular heart disease. We're here to provide the very best service we can to help with these debilitating valve conditions.